the gentlelady yields back. The chair recognizes Mr. Johnson for 5 minutes for questions.
Well, thank you, Chairman Guthrie. You know, in 2021, according to the CDC, Ohio had the fourth highest number of overdose deaths of any state in the nation. Every day when I'm back home in Ohio's 6th congressional district, I'm told heart-wrenching stories about this plague that has swept across Appalachia and that has ended so many young lives. It is no secret that eastern Ohio, where I call home, has been hit particularly hard by the opioid crisis. As a member of the Bipartisan Fentanyl Prevention Caucus and the Bipartisan Mental Health and Substance Use Disorder Task Force, I've witnessed firsthand the power of bipartisan work in addressing the epidemic. Opioid addiction does not discriminate based on gender, age, race, social status, or political view. It takes no prisoners. The work that our committee frequently recognizes as the most bipartisan committee in Congress, the work that we have done to combat this scourge is one that I commend. Whether it be the SUPPORT Act, the largest, most comprehensive legislative response to the opioid crisis, or our continued work eliminating barriers to mental health care and telehealth services, these efforts are making a difference. So my first question goes to Dr. Jones. In your testimony, you mentioned the CDC's Overdose Data Action Prevention Program and how it is used to understand the drivers of overdoses. You specifically referenced my home state of Ohio, and in fact, the Stark County Health Department in my district is using a geographic information system to pinpoint areas in the county that are being hit hardest by opioids and then share that data online. Stark County, home to Canton and the Pro Football Hall of Fame alone, has seen over 500 overdose deaths since 2012. Could you explain the real-world life and death impacts that these types of data sharing software and mapping has on communities? Are they helping bend this devastating curve in the other direction?
Thank you for your question. I mean, I think data are really foundational to understanding what's happening in a community, who is at risk and how is risk changing, and where should we deploy resources. And that's really the goal of our support to health departments, is to use the near real-time syndromic data, use emergency medical services data, use mortality data to really tell that story for a community. There might be assumptions that a community has of this area is more impacted than this area, but really using data to say, in fact, it's here where we need to be deploying resources. And so, especially with quick response teams, spikes in overdose with a toxic drug market, these near real-time data allow communities to rush in resources to connect people post-overdose to care so that they can receive life-saving care.
In other words, follow the facts, follow the science, right? And you make better decisions. A key component to combating opioid abuse is addressing pain care and ensuring patients and providers are informed of the continuum of non-opioid pain therapies. In 2019, HHS released its best practices for pain management task force recommendations with the goal of improving safe, effective, evidence-based pain care in America. Unfortunately, the recommendations of this task force have not widely reached clinicians. So, Mr. Bloom, have I got that right? Bloom or Blum?
Blum, sir.
Blum, I'm sorry. What has HHS done to distribute the task force recommendations, and will you commit to developing and implementing a strategic plan to widely disseminate those recommendations to clinicians?
Thank you for the question, Congressman. We agree that CMS programs certainly need to do more to expand.
What has HHS done?
We continue to work with care systems to identify better pathways for pain management services, but happy to work with you to find ways for us to improve.
Okay, all right. Well, I had another question, but my time has expired or close to it. But thank you, folks, for being with us today. Obviously, we've got a lot of work to do to wrestle this scourge to the ground, and I appreciate all that you're doing to help us get there. Thank you for being here today. I yield back.
Thank you. The gentleman yields back to Chair